What's up guys, Dr. Tyrell Detweiler here with Hybrid Performance Group. Today we're going to take a moment to talk about one of the treatments that we utilize in our office, a very popular treatment called dry needling. Dry needling is something that's becoming very popular here in the last probably 10 years or so, 5 or 10 years. So we want to take a little bit of a moment to talk about what dry needling is and just to kind of address some misconceptions or some fears that some people may have of dry needling. So dry needling is often kind of interchangeably confused with acupuncture, and although we're using the same exact needles as you would use in acupuncture, these are acupuncture needles, the approach to dry needling versus acupuncture is different. Now, acupuncture's been around for well over 2,000 years. Is a completely different kind of Eastern medicine look at the body. I've taken acupuncture courses, and I can definitely say it's an awesome treatment approach. It's just a different treatment approach when we're using these needles. Dry needling is a little bit more of maybe a Western take on some of the different physiological effects that go on the body when we do stuff like acupuncture, or just in general when we insert objects that are going to create a little bit of micro damage in the tissue and what happens there thereafter. So with dry needling, again, we're using an acupuncture needle, but what our goal is to actually go into the muscle tissue, the fascia, and basically utilize that to provide some sort of disruption in the tissue and signal the nervous system. Dry needling actually came from, the reason it's called dry needling is it is an advancement in another technique that was prolotherapy, in which we utilized just regular syringes to inject saline into the joints, and we were getting responses with healing in things like arthritis and pain responses, enough to where someone asked the question, well, maybe it's just the needle providing a stimulus into the body. So that's why we switched over to the acupuncture needles. They're a smaller needle, create a little less damage, but still get the job done. So in our office, dry needling is an incredibly popular modality. A lot of our athletes, a lot of our active populations like to use it. It is great for a multitude of different conditions, including sprains and strains, tight muscles. It does really good with different pain conditions, chronic pain, or maybe an acute injury. And as we're going to see in a little bit, it's actually really good for things like migraines even. So there's a lot of versatility that comes with the dry needling. It's a very effective, very to-the-point treatment because we're actually getting down into the muscular layer with these needles. So we use a couple different size of needles here. This one is a little bit smaller. It is a 30 millimeter length needle. This one's a little bit larger and comes in about 60 millimeters. So around just under an inch and just under 2 inches for these two needles. And again, they're very small, a very small diameter, so small you can't even push fluid into it. So some of the misconceptions there being that it's acupuncture. It is not. Again, it's just using the same needles to get a different effect or for a different intent. And the other one is that, oh my gosh, it's a big scary needle being put into me. Some people are going to have different reactions, but the majority of individuals come in, get needled, and the most common response I get is, oh, that was it, or I didn't even realize you took them out or that you put them in. So it's a very comfortable treatment, very good treatment option, again, for a multitude of different conditions. So if you have any questions, you want to reach out, find some more information about dry needling, we're always an open book. Feel free to reach out to us via email, feelgreat@hybridperformance.net, call our office 614-400-5327, or stop in, schedule a visit, and see what dry needling can do for you.